Hello, my name is Miriam. I'm going to be your nurse for today. Let me go ahead and wash my hands. Let me verify your name and date of birth, if that's alright.
María Rodríguez, 11-10-66.
Maria Rodriguez, 11/10/1966. I'm checking the information in the system. Information is correct. Do you have any allergies?
No,
Okay, perfect. She's not allergic to anything. Are you experiencing any type of pain?
no,
Okay. I'm gonna assess for orientation while I put on my gloves. Do you know why you're here today?
yes,
Do you know where you're at?
yes,
Do you know the time and date?
yes.
Okay, perfect. Now we're gonna go ahead and check the vitals, starting with the temperature. I'm gonna assess pulse oximeter. Make sure the nail has no nail polish. And get my blood pressure cuff set up. Perfect. Pulse oximeter within limits. Temperature normal. I'm gonna go ahead and check respirations and blood pressure. Do you know your typical blood pressure measurement?
No,
Okay, perfect. I'm going to inflate the cuff, assess respirations, and also blood pressure. Perfect. Vital signs are within normal limits. I'm going to assess the patient while she's laying down. Can you go ahead and lay down for me? I'm going to start with the head to toe. I'm going to assess first all the cranial nerves, starting with the 6 cardinal gaze, abducens. Oh, sorry. I'm going to grab my pen light. As soon as my pen light, I'm going to ask the patient, can you look up, follow the down, side, side. It's like a cat with whiskers. Okay, I'm also going to assess the Snellen chart. I'm going to place from 20 feet away. Can you sit down for a moment? And 20 feet away, I'm going to assess the Snellen chart. And I'm going to ask the patient to read just to see if she's able to see from far away. I'm going to go ahead and check the trochlear. Go ahead and lay down again. And that's going to be with the pen light once more. We're going to go up, down, side to side. And we're also going to assess Perla. And Perla, she's going to follow the pen light. That's ocular motor. Cranial nerve number 2, follow the pen light. Pupils, equal round and reactive to light. I'm going to start with the lymph node assessment. The lymph node assessment, the occipital, back here, parotid, here, preauricle, postauricle, tonsilary, submandibular, submental. We're going to have the superficial cervical. Then we're going to have the posterior cervical, the supraclavicular, and we're going to go ahead, and after we finish with the lymph nodes, we're going to assess the upper part of the body. We're going to start with the head, make sure there's no bumps, skin is intact. We're going to check for drainage Once again, I'm gonna grab my pen light. We're gonna check the ears for drainage or any occlusions that we might see. Great. Turn your head. Drainage occlusions, there's none. We're also gonna check the nose. The nose. We're gonna see if there's no abnormalities, any cysts. We're gonna check for the color, any drainage again. Okay, perfect. We're gonna go ahead and check the mouth now. Open your mouth, say ah. We're checking the mouth, the gums, the tongue, how many teeth the patient has in the mouth. Then we're gonna check the lymph nodes. We already did that. We're gonna check the carotid artery one at a time. Okay, perfect. We're gonna ask the patient to shrug her shoulders against resistance. Okay, she's able to do that. We're gonna auscultate the heart sounds. We're gonna start with the aortic. We're gonna move to the pulmonic. We're gonna go to the herbs, tricuspid, and then mitral in the 5th intercostal space. Rhythm regular. Then we're gonna go ahead and do the chest, lung sound assessment. Can you go ahead and sit down for me? I'm gonna ask you to breathe. Take a deep breath and breathe out. We're gonna go ahead and we're gonna assess the superior, the upper left, upper left, upper right, middle left, middle right, lower left, the lower right, the claustrophrenic left, claustrophrenic right. Now we're gonna assess the inferior, the frontal part of the body. We're gonna assess the trach. We're gonna assess the upper. Upper right, upper left, middle right, middle left, and lower lung right and lower lung left. We're gonna go ahead and ask the patient to lay down once more. We're gonna assess the body, inspect the skin, check the elbows for any markings, any bruises, any sign of. Now I'm gonna go ahead and check the bowel sounds. Before I do that, I'm gonna ask the patient, when was your last bowel sounds, and do you go regularly to the bathroom? Are you having any problems? ¿Cuándo fue la última que fuiste al baño o vas regular?
Hoy.
Okay, she went today and she goes regularly. I'm also gonna ask the patient about voiding. Is it regular? Do you feel any discomfort when you void? Cuando tu orina está regular?
Sí.
She said it's regular, she doesn't feel any discomfort. Okay, perfect. We already got that out of the way. We're gonna inspect, we're gonna auscultate, we're gonna percuss, and we're gonna palpate the abdomen in that order. We're gonna do the right lower quadrant of the abdomen, right upper, left lower. And if we don't hear any sounds, we're gonna stay for 5 minutes on each quadrant that we don't hear the sound. We're gonna go ahead and check the radial pulse. We're gonna check the radial, the ulnar pulse, both. And then we're gonna ask the patient to hold firmly in her hands. Perfect. And then we're gonna check capillary refill and skin turgor for hydration. Perfect. Then we're gonna move down and we're gonna assess the legs. I didn't mention we're gonna check if we had any jugular vein distension, which the patient doesn't have. We're gonna go down, we're gonna check the legs for symmetry, capillary refill as well. We're gonna check if there's any edema present. I'm gonna check overall the temperature. Okay, temperature is warm. I'm gonna check for edema, as I said, no pitting edema present. I'm gonna ask the patient to push against resistance. And then once the head to toe assessment is complete, I'm gonna ask the patient, does she feel safe? Do you feel safe?
Yes.
Okay, perfect. And then I'm gonna complete my head to toe assessment by removing my gloves, discarding my gloves, washing my hands, and documenting the information.